Welcome back. As a reminder, if you need technical assistance, our help desk is available. Also, please note that the handouts for today's session are available in the handouts menu. My name is James Coloma, and I'm a liaison with the Capacity Building Center for States. In this session, How Do We Know What Works? Challenges and Opportunities for Building Evidence for Leaders and Decision Makers is designed to discuss evidence-based practice through the lens in which leaders process information to understand what works and what does not work. This session will also discuss ways in which leaders decide what information is credible and whether programs are having the intended effect. In this session, you'll hear from 3 experts who will discuss ways how leaders in their field apply the knowledge and evidence to make decisions about how to improve outcomes for children, youth, and families. What are some of those promising things that are available to us around data and evidence? Alicia, I'm going to start with you.
Great. I think there's been a lot of promising development in the field. I started in this field 14 years ago as a young-ish PhD student. Very excited about working in child welfare and in an organization where we were telling judges what to do. And my first thought was, how do we know what to do? We have nothing, no evidence about what works or what's effective in the field. And now I can say several years later that we actually have plenty to rely on, at least a good starting point. So when they ask, there's things we can point the judges to that says we have some evidence that this works, why don't you try this? So we've definitely progressed a long way in building the evidence base, at least from an academic perspective, working with judges.
And Renda, what about from the tribal communities? What are those things that are very promising that you have knowledge of that you could share with our audience?
Well, I think what Alicia said about how, where do we go to find out what works? For in tribal communities, you go to Native people, and so some of the people that are doing great work are people like Bonnie Duran with community-based participatory research from a Native perspective, Maria Yellowhorse Braveheart and her research with historical trauma, Michael Yellowbird and the connections he draws between what Western science is finding and tribal belief systems that already existed.
Great. And Rebecca, what about from child welfare? What are those things that child welfare has done to move the field forward around data and evidence?
So I think in child welfare, we have been able to use evidence to make change and to importantly change direction. We used to think that long-term foster care was what kids needed in order to be safe and well, and we learned from those young people that it wasn't actually working the way that we intended. And so the field has shifted pretty significantly to understanding that there are some different practices that we need to have. And so I think the more we balance science with input and feedback from those that we're working with and serving, I think the better we've become. And we have some ways to go, but we actually have absolutely improved some of the work and practices in the field. And I think even in how we're sharing data and thinking about understanding where our gaps are has improved in many ways. And I think will inform us as we move forward and think about what are some of the new changes or the next phase of the field.
I'd like to talk now about how leaders collaborate between those agencies. And the first question that I want to ask is I'm going to start with Rebecca. How do we create opportunities for those organizations that have promising practices that don't meet that level of evidence and take that time to work with other agencies and give them the space to create that evidence?
So that's a great question. I think there's opportunities to include organizations in our oftentimes partnerships that we have with universities and those that are doing evaluations in relationship to our work that might support building evidence related to that. And I think another space that is an opportunity is being able to, certainly for me as a state leader, having relationships with other leaders across the country, being able to have conversations to see if there are actually other community organizations across the country that are doing a similar or the same practice, and see if there's any way for us to kind of jointly work together in that regard. And I think the other thing that I would add is is also thinking about, with some of the funding that we have, be it from philanthropic organizations or our own funding streams, state and federal, thinking about, are there opportunities for us to create space or even create convenings and have people at the table to be able to explore how we do that.
That's right. Renda, what about from the tribal communities? How do you all collaborate with child welfare and with the courts to create a space for gathering evidence and working with them collaboratively on what that might look like?
Well, one of the things that happened in Southern California, Riverside County specifically, was a nice collaboration between the Indian tribes. The tribes in California are small, so they tend to form consortiums. So the tribal community developing relationships with child welfare, and particularly the people at the top. We got to a point where we were having quarterly meetings with the directors of child welfare, and it was really the relationship, I think, that kind of opened the door to allow the Native voice to be heard. A lot of times what happens in these situations is, even if you do get a seat at the table, it's kind of like the legs on the Native side are shorter than the ones on the other side. And so I guess from the child welfare side of it, like really listening to what the Native people are saying and promoting their voice in a more leadership way in terms of the things that they're doing to implement practices.
Alicia, from the court's perspective, what do you all do with collaborating with the tribes and with child welfare to look at building up evidence for those spaces where there isn't any?
I think there are a lot of opportunities for the courts to be involved. I think the big thing we need to do is to continue to promote the value of that collaboration. There's been a lot of concern with using agency data. It's not court data, it's not my data, but recognizing that might be the best data that's available and the agency has it. So there's a real opportunity there to work together to better understand what that means for everyone. And I would agree with Renda, building the relationships is just critical for the courts to work with the tribes and tribal communities to see what that can look like and how they can work better together. The relationship piece is always a critical piece in getting that going.
Renda, how would you build those relationships with the courts and with the tribes? What is one thing that you would encourage those tribal leaders out there to do and ask from your leaders from the courts and from child welfare? What are those things that need to be lifted up to work together?
Well, one of the things I think from the child welfare and the court side of it again is they really need to do a lot of listening to the tribal communities. This idea that Rebecca said earlier about child welfare leaders coming together and collaborating, I think that tribal people doing that, almost kind of like putting together an American Indian think tank where they're really at the beginning, and a lot of times programs are brought in but they've sort of already been conceptualized, or these are the parameters, so there's not really room for that tribal voice. And so from the point of conceptualization of what we're going to do is a really important piece.
I love that idea because I think you're exactly right, is that oftentimes, for better or worse, we come already with an idea, even when we're engaging with our families and our youth and children, come with the idea of what we think is the best way to do something, or what the intervention is that they need, or what the community needs, as opposed to kind of flipping it and saying, we want to partner and work with you. Let's think through what this is, and you tell us what it is that is needed and how we can help and support that.
Alicia, what would you say to Rebecca and to Renda about how to encourage a collaboration between those agencies and open up that space of inviting people to be at the table right at the start?
I think think a lot of it goes to this lack of understanding in the field of the value of what the collaboration can bring, what it can mean to the field, what it can mean to others. So in promoting that value and helping our courts to really understand, and the court leaders, that this is a critical piece of the puzzle. And if we're ever going to know what works in the field, we need to be talking to everyone and asking them, what works for you? What does this mean to you? How do we do this? So bringing people together is going to start with making sure that they understand the value of that and how it can help them do their jobs better, but also better serve children and families.
Rebecca, do you have an example of how this conversation and this relationship has been happening with your agency and with the courts and with the tribes to look at what type of data increases the outcomes for children, youth, and families?
Yeah, and I guess what I can say is that we have some examples for Maryland around how we've done it with families, how we've done it with youth, and even how we've done it with courts, and not so much with the tribes. And I think, you know, what we would oftentimes say is we don't have federally recognized tribes in Maryland, but we absolutely know that there are tribes. And so I think in some ways it's figuring out how do we create that space. We have conversations and have joint meetings and things like that, but it's never really been in the spirit of what Renda's talking about in regards to kind of working with the tribal community to really have it be an organic identification of what's needed, and then figuring out how can we actually support carrying that out. And so I think there's some great opportunities for us to be able to do some things differently with our tribal communities, but also for our other communities that maybe don't have the same space at the table currently in the work that we're doing.
And Renda, what would you ask of child welfare or the courts to bring you to the table, to bring the tribes to the table?
You know, tribes are so different. There's over 500 tribes in the country, and then there's this huge urban population. Like most actually American Indians are not living on reservations, so it's really complex. California happens to be really diverse, a lot of different tribes, and so identifying someone that's native, I guess, within the community that can help you figure out in terms of your city, your county, how to begin to navigate the relationship with the tribes, who has a voice. And you're looking for native people that have some experience in the field, but also have a pretty strong American Indian worldview, because if you're not going to do it from that perspective.
Thank you. We've also talked, or you've also all shared about what is data and what looks like good data. How do we collaborate together on building a shared data set from the perspectives of building up that evidence? Alicia, what would you say that is needed to help build that data between child welfare, the courts, and the tribes?
I think the main thing is a better understanding of what data and evidence are, and a more openness on behalf of the courts in particular, but others as well, to share that information. We come from a very siloed background where we have our data and we're not sharing that with anyone, and we don't know how people are going to take it or how they're going to use it, and so there's not a lot of sharing. And even within the courts, between their colleagues in the next county, they might learn something very useful or have data that could help others, but it stays there. So we don't really disseminate what we learn, so we're not ever learning from each other. So helping to understand the value of your data is valuable, their data is valuable, the data together can give you a more robust story. Let's try to do something there. So helping them really get how important it is to share and break down some of those walls.
And Renda, from that tribal perspective, how do we get the tribal data to, into the ways that child welfare and the courts could use it?
Well, some of the native people out there that are working on this right now, and a lot of times it's talked about as sort of decolonizing research. Michael Yellowbird does a lot in the field of social work on that. Bonnie Duran at the University of Washington also is doing a lot with community-based participatory research within our communities, and so it's the programs that she's doing. It's not just community-based participatory research, but it's from a Native perspective. Like that's what she brings to it, and so so there are people out there with a lot of expertise in this, and so. You know, as I said, trying to partner and collaborate with people that have delved into these areas.
And Rebecca, from Child Welfare, what is the ways that you talked about the CWIS system? It's a very siloed, individualized system. How do we open that data up, those data sets, to share with Child Welfare, to share with the tribes, and to share with the courts, and to build a shared collective understanding of all this data that we have out there?
I think there are a couple of things. One, I mentioned in the opening session earlier around the relationships. And I think the relationships, both with our community partners, is absolutely essential, but it's also the relationships among us as organizations and communities, so that there is a space that's safe to be able to look at the data and information and have really honest and transparent conversations about it, and not have to kind of move in fear of, well, what is that person going to do, or what is that organization going to do with my information? So that is an essential piece of it. I think the other piece is really, intentionally thinking about how do we expand what we consider valid data, evidence, information outside of the information systems that we have. And so CWIS, our SACWIS systems, and CWIS ultimately are, data systems. CWIS builds in the expectation that systems are actually talking with each other and sharing data, and there's interoperability, but those are numbers and information, and still not necessarily drawing out the humanity and the humanness of the work. And so I think figuring out how do we build in the stories of those that are working in the systems, but also those that are being served into what is considered valid is going to be really important as we move forward.
And lastly, what is one hope that you have for our system about how our collective information can help to build evidence-based practices so that we could figure out what works for our children, youth, and families? Brenda, I'll start with you.
Well, I guess the hope that I would have is exactly what comes out of those Native reports and focus groups, that the efforts are to support and sustain the cultural practices and traditions that tribal communities are saying that they want, and that really sustained them for thousands and thousands of years. Most of what evidence-based finds in terms of what's protected for children and families, tribal communities already had those things. They were just hit really hard through the process of colonization. And so efforts to sustain and revitalize culture and tradition.
Alicia, what about from you?
My biggest hope, and has been for a long time, is that the folks that are out there working in the courts will recognize that they're already doing some good work. They're collecting data, they have information, and it's valuable. And that they would share that and disseminate so that we can all learn. I feel like if you're not going to be able to get up to an evidence-based practice, we still have great opportunities in the field by taking some of these modest but meaningful research studies and seeing what they all say and looking for trends across those. We'd have a good foundation if we could get everybody to start sharing those more broadly and letting us learn from each other.
So one thing, also I just want to say, so when I was doing the National Institute of Drug Abuse randomized clinical trial, we were paying people like, $400 to fill out assessment data and going everywhere, beating the bush, please be part of our study, be part of this intervention, to get the numbers that we had. And when my daughter did this play, it was supported by a tribal cultural center. And we had no idea how many people were going to be there, how many programs do we make, it's just a hall. And over 100 people came pouring in the door, standing room only, filled out evaluations, like without us even really trying, just laid them on the table, 74 evaluations back, which would take us 5 years to get other kinds of studies. So when you hit what the community wants and what they need, it's a much different response.
That's great. And Rebecca, what is your hope?
My hope is that we take what we know and actually put some action to it. So we know that systems aren't functioning in the way that ideally they should or need to. There's so much to draw on from Indigenous communities and historical, ancestral practices around family and community that we oftentimes kind of forget, but then expect people to behave in that way in some kind of artificial settings. And so I think to kind of wrap it up in a nutshell, it would be that we are better at actually putting humanity into our data and information, and having that drive what we need to do and the decisions that we're making, and be able to push each other as family members around where we need to continue to grow and strengthen and not get comfortable.
Brenda, Alicia, Rebecca, thank you so much for sharing your knowledge and wisdom with us today. And thank you for joining us in this session. We look forward to seeing you in our next session.